On to our next cornea surgeon, Dr. VIJAY Sharma, who is a senior consultant from the Department of Ophthalmology of Army Research and Referral Hospital based at Calcutta. Am I right, Dr. VIJAY?
Am I audible, ma'am?
Yes, yes. So
yeah. I have shifted from Army Research and Referral Institute now in Kolkata. It's a command hospital. So it's in Kolkata, and I'm practicing now there. Earlier I was in Delhi. So yes.
Yes. Can you we look forward to hearing your case, a similar corneal situation.
So continuing Dr. Gautam's thing forward, I will be discussing how to improve the outcome of cataract surgery during the triple procedures. Now, as I'll be discussing few cases about this. Now, this is a case of adherent glaucoma where we had planned a triple procedure in this case. Initially, after making a paracentesis, the iris was dissected away from the corneal opacity, and then careful dissection of the corneal button was done all around, again separating the iris carefully from the underlying. As you can see, there is iris adherent to the part which is being cut now. Now the pupil was non-dilating and it was a total cataract with a very hard nucleus. So a Meligan ring was placed at this point of time for dilatation. Now it serves two purposes here. One, it gives a good dilatation and your rhexis becomes very easy at this point of time. The other aspect is it counters any positive vitreous pressure which comes from posteriorly, because this Meligan ring scrolls are placed under the margins of the remaining host cornea. So that counters the positive pressure, any positive vitreous pressure, and prevent any extension of the rhexis anywhere, and also it prevents any vitreous loss at this point of time. So now this, since this was a large nucleus in this case, so we had to remove the Meligan ring before removing the nucleus. Now, after removing the nucleus, cataract, whatever cortical matter is left, that is removed, and rigid IOL is placed inside. And after putting that, then whatever is the remaining inner ledge of the cornea, that is removed, and a corneal button was placed, and corneal transplant was committed this way. So a similar case, another case where the nucleus was not that hard. Now again, a case of corneal opacity with cataract, a triple procedure was planned. Again, a Meligan ring was placed at this point to prevent any positive vitreous pressure causing any complication at this point of time. And it is gently, the scrolls have to go under the remaining post corneal tissue. Now, then it provides a very, very good stable, almost as stable as a closed chamber. That much stability is there. The rhexis does not extend, and also you do not get a vitreous loss from that. Now here the Meligan ring is placed. The nucleus was not that big, so it could come out through the Meligan ring, and then you can do the cortical aspiration very comfortably, because you are getting a counter pressure by the Meligan ring against the vitreous pressure. So you can see the whatever is the cortical matter, that you can remove that very comfortably, and then you place IOL. Either you can put a multi-piece, or you can put a rigid IOL. Even you can put a foldable IOL if it is affordable. And once you have placed the IOL, then the corneal button is transplanted. So this was the second case. Now another case of a similar type where now this is another case. The patient had a perforated corneal ulcer and had undergone a therapeutic penetrating keratoplasty, had a lot of adhesions, iridocorneal adhesions at the graft host junction, and the angle was also obscured. So initially a gentle dissection of the iris from the angle and the graft host junction is done, and there is a thick membrane in the pupillary region. Then that membrane also needs to be removed. This patient then was planned for optical penetrating keratoplasty with by doing a triple procedure here. So dissection of the pupillary membrane is done, but cornea was relatively okay here to provide some visibility. So here the Meligan ring is placed directly at this point of time, because the pupil was non-dilating, and also there was the iris was not there in around 120 degrees. So once phacoemulsification was completed, then whatever is the residual cortex, that was removed, and then IOL was placed under observation carefully. And once this was done, Then a pupilloplasty was also done at the same time, because the pupil was not, the iris was absent superiorly. So pupilloplasty was done. But this provided two advantages. One, it freed the iris angle from any iris, and also it covered the optic well all around, and it provided very stable anterior chamber subsequently, and prevented any post-op intraocular pressure rise. So this is the last case. You can see the first photograph where perforated corneal ulcer, and then underwent a therapeutic penetrating keratoplasty. Here you can see superiorly from 10 o'clock to 3 o'clock, the iris tissue is almost absent. And then you can see the first post-op day, and that is the 1 month post-op day. The patient regained vision from just perception of light to 6/18 at the end of the 1 month. Thank you very much.
Brilliant surgeries, Dr. Vijay. And only thing I was wondering that in an open sky technique, I was actually wondering, putting a Malugan ring would actually induce more positive pressure, is what I thought. That should be, you could have instead done a hinged flap and kept it covered, and then completed your phacoemulsification.
Actually, ma'am, it counters the pressure very well, because all the 4 scrolls are under the host corneal margins. So that controls any positive pressure which is coming from behind. We published this in JCRS in 2019 also. And and now we are routinely doing in all cases where the pupillary dilatation is not there, and we are planning a triple procedure in those patients. So we are doing this routinely, and we haven't had any vitreous loss, at least, and an extension of rexes after that, after we have started using this technique.
Yeah. Any thoughts, Dr. Purinder Bhasin or Dr. Arun Jain?
No, very very innovative use of Malugan ring. I see very beautiful outcome in all the cases. So congratulations to you. Very nicely done. All surgeries with good outcome.
Yeah. Truly wonderful.
Yes. Wonderful. Yeah. No comments.
No comments. Yes. Dr. Sanjay Chaudhary? No comments.